multiple branches in Lagos and one in Delta State. We have 2 branches here in the Victoria Island section and also one in Ikeja. The hospital is run primarily by 7 partners, supported by a strong technical team of other specialists and non-specialist doctors, nurses, and allied healthcare professionals, and a very strong administrative team. Our vision is to redefine healthcare in Africa. We have a mission to provide safe, timely, evidence-based, technologically driven, patient-centered healthcare, and this is in everything that we do. Our value proposition is high reliability, getting it right the first time, every time. And our motto is service with integrity. We have in-house competencies in primary care, pediatrics, general surgery, OBGYN, and endocrinology and critical care. We have, in addition to general outpatients, we have also specialists, obstetrician, gynecologists, pediatrics, general surgery, and other services as well. We do have a very active outpatient clinic, which takes place at our branch on Moshood, Olugbani Street. We have an in-house quality assured laboratory, radiology, and pharmacy. Our lab is 24/7. Our pharmacy is also 24/7. We also have an excellent track record we earned in the first Safe Care, having the first Safe Care Level 5 award in Africa for quality of care and quality improvement. And we got it in 2016. We did it again in 2020, and we are going to do it again. We do have a very, very active quality assurance department here at PLM Memorial Hospital. Now on to our speaker, Dr. Shobowale is a podiatrist based in Houston, Texas. She is, I think, currently here in Nigeria, and she's also going to run some clinics. She's an exceptional podiatrist, very passionate about personalized care for patients. And as you would see, she's also very passionate about educating the patients on foot care. Our first session was a hit, and I look forward to what she has to share with us today. Okay, so without further ado, as time has far gone, Dr. Shobowale, if you can please share your screen, and we start.
Okay, hello, good afternoon, everybody. I'm Dr. Shobowale. I am, like she said, a pediatric foot and ankle surgeon and physician that practices in Houston, Texas, but I am in town, well, I am in the country, and I will be seeing patients at Pelon Memorial this week. So hopefully any burning questions that maybe if we don't get to here, I'll get to answer it for you once I see everybody in clinic. So that being said, let's start the PowerPoint. And so what I wanted to just kind of share or talk or educate people about is some of the things that you can do at home to take care of your foot and ankle needs, maybe in a situation where something's happened and you maybe don't have the opportunity to go to see your doctor, or your appointment is not, anywhere close, but some things that you can do to kind of manage the discomfort that you may have, essentially. So like I said, I'm going to move this so I can see. Okay. So I said, again, understand the different factors that leads to, the pain, and just kind of give you a little bit of options of what you can do to kind of help it get better. We know that a lot of the times when patients have foot pain, foot and ankle pain, it could be injuries due to, accidents or sports, or just doing the regular things. Some patients may just say, hey, I haven't done anything different. I've just been walking normally, but inadvertently, they've been overusing the limb. And especially, let's say a patient with diabetes that doesn't have sensation, they wouldn't realize when they've been, walking a lot. Or just wearing footwear that is not, doesn't fit properly. It's old, it's not supporting as it's supposed to. So some of those could also cause, pain and be the reason why a patient is having a discomfort. And of course, we have other disease processes that could be causing issues as well. So the most common things I see, or the most common things that people talk about, plantar fasciitis or heel pain. They say they've been standing or walking a lot and their heel is hurting tremendously. And of course, arthritis, and there are different forms and types of arthritis. And then tendinitis. So here it says Achilles, but there are other kinds of tendons in the foot and ankle that really hurts. And we can talk about some of the ways to get it better. So plantar fasciitis, I'll start with that. That's heel pain, essentially. Most patients will come and say, you know, their heel is hurting. It hurts the first thing in the morning when they get out of bed, or if they've been sitting for a while and they go to walk, then they have this tremendous amount of pain that they cannot get rid of. And the plantar fascia, it's really a thick ligament, band of ligament that attaches from the heel all the way to the toes. And so when you're moving it, let me move this out of the way. Hold on, so we can. All right, so that's that thick band of tissues attaches all the way to here. And so when you're moving, even when what happens is when you're moving your toes and these joints, you're pulling on this insertion site. And one of the things that happens that causes this kind of heel pain is not that just that you're standing for a long time. A lot of the times this band of tissue is super tight. We haven't been stretching. And surprisingly, the Achilles tendon here also is tight. So when this is tight, it's putting more pressure on the bottom of the foot. And so our idea is like when you've been sitting for a while, your foot is more in a bent position, and then you go to stand, you pull right on that insertion site, and that causes really, really bad pain. Let's see. Okay. So, like I said, sometimes, like I said, one of the reasons, you know, you've been standing, but repetitive strain and overuse can also cause it. You know, if you have some foot deformities where you don't have an arch, so it's completely flat, or you have too much of an arch. So just take a look at your foot. An interesting project that you could do to find out if you have flat feet or high arched feet is just apply some sort of water-based paint at the bottom of your foot and step on a white piece of paper, and you can see how, you know, you see how your foot forms. If it's completely flat, you're going to see the entire imprint of your foot. But if it's really high, you're only going to see the toes and the ball of your feet and your heel. Either way, those foot deformities could cause heel pain as well. Of course, obesity, you know, the heavier the patient is, the more weight they're putting, and then tight calf muscles, which is the Achilles tendon we're talking about there. So we talked about the symptoms: pain first thing in the morning, or you've been sitting for a while, or, you know, if you've been standing for a long time. We know a lot of us, you know, we have family members or friends who work in maybe perhaps jobs that requires them to stand, and they'll have that sort of pain. Next thing, arthritis. Arthritis is really, again, a broad term where there's inflammation in the joint with loss of cartilage due to, you know, increased range of motion, or, you know, leading to decreased range of motion. There's sometimes stiffness and pain and discomfort. Now, arthritis is not just, you know, it could be caused by different things. It can be caused by, you know, overuse, you know, they'll say old age, or rheumatoid arthritis, psoriasis, or, you know, some people say rheumatism, you know, things like that. So those could cause arthritis or show up in the foot as well. Then osteoarthritis, like I said, this often works or happens in joints where we're using it all the time. So most common joint is our knees or our hips or our spine, but you can also have it in the foot. You can have it in the ankle, you can have it in the midfoot joint, you can have it even in the big toe. So that's how it applies to me. I see it a lot in the big toe and the ankle and in the joint underneath it. And patients would just say, my foot hurts, but really it's arthritis that's happening. Rheumatoid arthritis, again, from, you know, a patient that has rheumatoid disease, it can cause the body to kind of react against what we call the synovial fluid. The fluid that's in our joints sometimes will get inflamed because the body's essentially attacking itself. It's an autoimmune disorder where you can't tell that this is part of normal tissue, and it just starts attacking it, and it causes pain, deformity, stiffness. And in rheumatoid, the big things you see is not only is the joint hurting, you start to see deformities like this. You start to see hammer toes like this, corns, the toes start to, you know, go in different directions than they're supposed to. So that is a signal, that's a hallmark sign of, you know, not just any regular arthritis, but is likely rheumatoid arthritis. So kind of similar to what you see here, where the toes are not straight anymore. They start to curl, they start to stiffen, and they start to cause pain at the tip of the toe as well as at the top here. Okay. Again, one of the common symptoms is, you know, discomfort with activity after long periods of, you know, if you've not been walking for a while and then you go to stand, it gets really stiff. So you have to kind of warm it up and stuff like that. Okay. So again, some of the manifestation of rheumatoid arthritis is things like this. You see the toes are crossing over. You see, bunions, sometimes claw toes, and these could be source of really, really bad pain, okay? So just showing some more pictures of rheumatoid arthritis and what it can look like. So if you see a family member or a friend that has something like this and they're having pain, this is something that we can definitely help to fix and make feel better. So this is like a worst case scenario where you see the toes really just deviate and, they dislocate at the joint, and it's painful. They're usually sores here. Just look at this fifth toe. You can barely see it because it's under over here. So it can get really bad. So you don't want to leave it and ignore it. So tendinitis, for Achilles tendinitis, and again, I would make a broad one for this and other tendons in the foot. It's again inflammation of the Achilles tendon. It could happen with trauma or it could happen with overuse. Some patients will either see the inflammation right at the insertion or here. So if you've been wondering if your ankle's been hurting, sometimes you could just run your hands through the back of your ankle and you may feel this bulge right there. And sometimes it's very tender. A lot of people may not know, what to do with it, how to treat it. And they are difficult to treat, but it is one of the things that we can talk about, some ways that you can get it better. Again, it's caused by overuse, meaning you're just doing something repetitively and not giving yourself a break. You're not resting. We're not stretching. So because we're not stretching, we're having tight calf muscles. And then if you're having shoes, improper footwear that's rubbing on the Achilles tendon, that can also cause discomfort and pain. So symptoms, it's usually gradual. It doesn't happen all at once. You start, it starts with like maybe a mild irritation, and then it increasingly gets worse, especially, if you're not stretching as much as possible. And then, of course, the more you use it, the more active you are, the more it becomes, painful and things like that. All right, so how should we address it? So here we're going to talk about some of the things that we can do at home before you see a doctor, or even in between or while seeing a doctor, to kind of help. All right. So for tendinitis, yes, we could talk, or a sprain or a trauma, rest and icing and elevating are always a good idea. If there's swelling, the more you elevate, the less swelling you get. The less swelling you get, the less pain you get, because swelling comes with pain. Swelling comes with increased deformity and stuff like that. So if you can reduce the swelling by elevating it and icing it, and sometimes even compressing it, it will really help to reduce that swelling and help to reduce the pain. I said icing right now because what icing does is it causes what we call a vasoconstriction. So our blood vessels that are going to increase blood flow to the area of injury are widened during the time of injury. The ice will then make those blood vessels shrink, which will thereby reduce swelling, thereby reducing pain. So you want to kind of do it, but be careful if you're a diabetic. So if you're a diabetic and you don't have adequate amount of blood flow, you want to be careful because sometimes they can't feel. You don't want to get what we call an ice burn. Okay, so make sure that there is like a piece of cloth between the ice and your, the area that is hurting. So if there's one thing you take away today is if you're swollen and you need the swelling to come down, you ice it. If you are stiff and you need your joints to move, you can then use heat, because heat will cause, again, what we just said, vasodilation, meaning the blood vessels will expand, increase blood flow, and it'll sort of help to, lubricate the joints and you can move it more. Okay, stretching exercises. So this is the one single most important thing for heel pain. If you're doing your stretching exercises, and the most important things, you want to stretch your Achilles tendon and your plantar fascia. That is really, really what helps you to avoid that heel pain. And I tell my patients to stretch at least 3 times a day. Set a reminder if you have to. You need to stretch, and you need to make sure that when you're stretching, you're feeling that stretch right there in your calf. Okay, so you want to make sure that you're putting your entire foot nice and flat on the floor. You're pushing on the wall, and you're going to do it with the knee straight and the knee bent. Okay. So when that happens, we're stretching these muscles right here because they contribute to the Achilles tendon. If we don't stretch this and we're only stretching our foot, that heel pain is not going to get better. So my tip is, first thing in the morning before you get out of bed, just roll your foot and warm it up as much as possible. And then get on the floor, but don't put your entire heel on the floor yet, because if you put that first step, is really going to hurt. So start with the tip of your toes, the ball of your foot, and then just slowly ease it down till it just lays. But don't put weight on it. Just let it lay flat, and then do the stretch until you can feel this. You want to bend as much as possible in this angle there, okay? And then after a while, you can bend your knee a little bit and it's then focuses on this. That is really what's going to help it. And I promise if you do this at least 3 times a day, you're going to get better, okay? Then another one is a towel stretch. So you can do this before you get out of bed. You can use a towel or a belt or anything that will not stretch. And what you want to do is put it in the front of your foot and pull as much as possible. It's doing a similar thing like we just showed in this video, in this picture, but you're doing this while you're seated down. Okay, it just helps that first step in the morning or that first step when you've been sitting and going to move. And there's of course a plantar fascial stretch, and you can do this 2 ways. Let me see if there's a picture. There's 2 ways. You can pull on your toes till you feel that stretch here. Remember we said the plantar fascia is a thick band of ligament that attaches to the heel and all the way here. So you want to be able to feel that stretch as much as possible when you're doing this. Also, you can put your tip of your toes on the side of the wall and push it so that it is more, it creates this angle that does the same thing. So again, dedicate at least 10 to 20 minutes 3 times a day to do these stretches, especially if it's really, really hurting you. This is what's one of the things that really help. Another thing is a toe curl. Like you see, you just put a piece of towel or any piece of paper and try to pick it up. That increases the range of motion of that band that we talked about that's down here. All right, it warms it up and just kind of lets it know that it shouldn't be tight and it needs to stretch out. Again, do these 2 to 3 times. I'm going to keep repeating myself because that's what I feel like is going to drive the message home. You need to do the massages to, the stretches to get it, to make it feel better. So here, you can use a ball here. And I personally like to use a frozen bottle of water, and that's something anyone can get. You get a frozen bottle of water, and it does 2 things. The hardness of the bottle is performing the foot massage and breaking down all that scar tissue and inflammation that you have in your heel. And then the cold water or the ice is helping with the pain and discomfort. So both of those, using a frozen water bottle is usually my go-to. I say label it like your foot water bottle that's frozen, and then use it to really ice, especially when it's hurting. That's really something that's going to help it get better. Oh, see that. So the picture here shows how you're going to roll it, and you just roll it all the way. Okay. And that really helps to calm the inflammation down and stretch and break down some of that tightness in the fascia. And it's important to note that we also have to watch out for what we're wearing. So if you're wearing a shoe that's going to be causing extra pressure on your heel, well, I mean, that's not going to help regardless of how many, times we do these massages or these stretches. So watch the shoes we're wearing. We want to make sure that they have good support in them. You want to make sure that you can't just fold your shoe in half and, fold it up like a piece of paper. It needs to have good support in the base. It's carrying your entire weight. So watch that you're wearing shoes that are not excessively bendable, and then they can hug your foot as much as possible. Now, inserts are things that we also give for heel pain. And this will be something where if I speak to a patient and I feel like they would benefit from this, we can arrange to get you an insert. They are soft cushion that you can either make them custom or we can get some prefabricated ones that are really good. And you see what the idea here is it supports your arch so that plantar fascia, that ligament that we talked about, is firm and supported. And it also has a soft heel to kind of help your heel, especially when you have heel pain. So if you do book a consultation, we'll talk about it and see if this is something that will work for you. Of course, we have over-the-counter medications that you can get, to help with pain. But I don't want us to take this, all day, every day, because then we're only masking the problem. The stretching is the important thing. And again, this is the stuff you can do at home. If you were in the clinic and you had heel pain, there are things that we can do, medications that we can inject into the area to help with the pain and discomfort. But, any over-the-counter pain medicine, can be used to manage it while doing everything else that you need to do. All right, so what other things can we treat at home or manage at home, I should say? So foot fungus. A lot of people have dry, scaly skin, and they're just like, oh, my skin is just dry. I shower 5 times a day. I put Vaseline, and it just doesn't get better. But sometimes if it's not getting better after you've been moisturizing, you probably have a fungus. And fungus is among us. It's a cheesy term that we say. It's everywhere. You can pick it up wherever you go. And what happens, it also mimics a dry skin, but it's itchy. It's flaky, it starts to peel, and it spreads. Sometimes you see it around your skin, and you can pick it up in restrooms and things like that. So one of the things that you can do, number one, you want to make sure if you're wearing closed-toed shoes that you're changing your socks as much as possible. Okay, you want to make sure that if you're sweating and walking around, and you want to change your socks, get an extra pair of socks, because fungus thrives in dark, wet, and warm areas. So if you have your shoe or that is wet, or your foot is sweating, or you're not wearing socks, or you just sweat, then you have to air it out every once in a while. You want to reduce that moisture buildup. Don't wear the same shoes back to back. Let the other one air out so that it's not encouraging fungal growth. If you are in a public place, you want to make sure that you're avoiding barefoot walking, especially in places that have water. So like, let's say, I don't know, the bathroom or the restroom, pools and things like that. You want to definitely avoid walking barefoot, because it's a gym. It's definitely a perfect place to pick up fungus from other people. Of course, making sure that you're washing your foot daily and drying them thoroughly. So what I mean is dry between your toes. If you feel like your toes are usually squished in a shoe, dry between your toes as much as possible. Literally pass that towel through. If you have a fungus, we're able to prescribe an antifungal medicine. But one of the things that, you could do is make sure that you can also put powder in between your toes. That helps to keep it dry. So like dusting powder will be good to absorb the moisture and keep it dry as well. If you see that you sweat a lot, you just have super sweaty feet, another home remedy that you can do is actually get an antiperspirant. So the same deodorant that we use under our armpit, you can also apply it to your foot. We're using it off-label, but the idea is to reduce the amount of sweat. So the same thing as doing in the underarms or in the armpit is the same thing it's going to do in the foot. All right. So we said again, drying our foot is important because, again, fungus thrives in dark, wet, and warm areas. So our foot in closed-toed shoes, especially, if our men who wear their shoes all the time, this is something that will thrive in that area. So these are examples of what it looks like. Again, drying between your toes is important, and you can use like and over-the-counter creams and powders and stuff till you get a prescription strength medication. Another thing you could do is tea tree oil. In a mild case of a fungus, tea tree oil helps as well. And tea tree oil can be very strong, so you want to mix it with a carrier oil like coconut oil. So if you feel like you're having dry, scaly, feet, and you're not sure if it's fungus or dry skin, just mix a little bit of tea tree oil and coconut oil and use it twice a day for at least 2 weeks and monitor to see if you're getting better. Okay, if it's getting better, then it's more likely that you had a fungus. All right, and make sure again you test it, because tea tree oil can be quite harsh if you don't mix it. So toenail fungus, we see this all the time, and a lot of times you see skin fungus and toenail fungus together, and the same thing that causes the skin fungus causes the toenail fungus. If you've gotten this bad, honestly, you definitely need to see a doctor, because there's not a home remedy that will help something that is this advanced. Now, if it was about this, like it just looks like this part here, then we could try some of the home remedies. Again, keeping foot dry and moisturized is important. We talk about tea tree oil. Again, you can still use them on your toes. And this would be a good one where they're having a mild fungus. So tea tree oil will work. Another interesting home remedy is garlic. So you can blend and crush up garlic and apply it to your toes if your partner, roommate, friend can stand it. But if you can do that and apply it to the affected toenail and leave it for a few hours, after a while, it starts to work, because garlic has antifungal properties that really help to prevent fungus. Now, this is a severe case, and this needs medication to treat. But in mild cases, perhaps like this one, anecdotally, meaning, there's no research, but, people have talked about Vicks Vapor Rub and how it really, really helps. So that's another one that you can just apply it to a mild fungus. Again, if it's moderate to severe, so moderate is about this is mild, and this one is severe. Moderate to severe, you need medication, but a mild one, Vicks Vapor Rub, garlic, Listerine mouthwash. If you have, any of these mouthwashes here, sometimes, if you soak it for about 20 minutes, it helps to kill the fungus as well. Okay, apple cider vinegar is another one. If you have apple cider vinegar, you can soak your foot in, for about 15 to 20 minutes. So this is more like a mild to moderate fungus, and just do it daily, and you should see that it starts to help and starts to improve. Olive oil extract, the same one that we use for our anointing oil, the same one also in a good organic, finely pressed olive oil will help. It's a longer process because we're using natural things that you can find at home, but it is something that if you're consistent with, it will start to get better. All right, so foot sprains, or strains, if you you're walking, you slip, or you have an ankle sprain. Of course, we talk about the RICE method, meaning you rest, ice, compress, and elevate. I touched upon it a little bit in the beginning of the presentation. So that's what the RICE stands for. So first things first, you need to get off of your foot, rest it as much as possible. If it's swollen, you need ice. Ice is what helps with the swelling. Now also compression. So, using one of those bandages to kind of press down. It's kind of how when we're young and you bump your head and your mom is pressing your koko down so that it doesn't swell. It's a similar idea. You want to compress it so that we don't give the blood vessels a chance to leak out in the area that could then cause a bruise and things like that. Again, we said swelling causes more pain. So it's important, like I said, to wear supportive shoes. If you can flip your shoe like a donut, then it's just not supportive enough. Okay, so you need to be able to wear super supportive shoes. Again, we can talk about the orthotics if you do book a consultation, and we can see if that's something that would be beneficial to you. If it's, again, for sprains, you don't want to immobilize it for too long, however. So one of the things that I tell patients is you rest it, but don't rest it more than a week. If it's because you want to keep moving it after a while. If not, it becomes stiff and causes problems. So making sure that after a week you're having adequate range of motion, you're moving it little by little. It'll hurt a little bit, but you want to remind your tendons that this is the job that they do. Okay, so a gentle stretching is very, very important, but while you're still resting as much as possible. Taping or strapping, that's something that, if you had a first aid person around, they could help you. And these are more specific for specific injuries. And I can talk more about, acute trauma, like how you twist your foot. And if this part is hurting, this is how you tape. If this part is hurting, that's going to be much more of an elaborate presentation, but essentially you can tape your foot as well. Now, warts. This is another common thing that some patients will see, and they will just call it dry skin. But warts are a viral infection that affects the skin, and they live in the blood vessels that are deep within our skin in the dermis. So the top layer of our skin is called the epidermis. The deeper layer is called the dermis, and that's the area that bleeds. And so these viruses go in and attack the cells there, and they cause these appearance of these kinds of lesions, okay? So what can you, before you see a doctor, one of the things that you can do is, I don't know if they have over-the-counter salicylic acid here, but that is an option that we can do in a small wart that that helps. If I see and identify a wart during the consultation, I can, arrange to have, wart over-the-counter salicylic acid brought so that I can show how to treat it at home. Duct tape is something that everyone has sworn by. And I think the idea is, you're suffocating the wart because the viruses are living from the blood vessels and the dermis. And so if you cut a piece of duct tape and put it over the wart and leave it on for several days, the idea is that it'll slowly start to shrink it. It takes a longer time to work, but, they swear by it. So if I see a wart, or if you think you have a wart, there are things that you can do at home that can help with the salicylic acid and the duct tape. Some patients also talk about apple cider vinegar. You can put apple cider vinegar on it, and sometimes that helps as well. Now, next thing, wounds. So wounds, and this is for non-diabetic patients. Of course, if you have any kind of wound, we know to wash it with soap and water. People use peroxide. Peroxide is actually harsh to the cells and doesn't let the cell heal initially. You can use it to clean off the blood if you have a wound that's bleeding, but don't keep using it, all right? Because it tends to damage the tissue. The most important thing that you want to do is you actually want to apply either a topical antibiotic ointment over the counter, or even something as easy as Vaseline. Wash it with soap and water and just apply Vaseline over it. The Vaseline acts as a barrier against outside bacteria. So doing that also helps. Now, if you're diabetic or you have poor blood flow, then you definitely want to see a doctor, because in those patients, they don't heal in the normal timeline that healthy non-diabetic patients heal. So after you've cleaned it and washed it and applied Vaseline, please go see a doctor if you're diabetic or you have poor blood flow. Let's see, did I get frozen? All right. You want to, of course, make sure that you're covering it. You're not just leaving it out to the open so flies can get on it and things like that. We want to make sure that we are keeping it nice and clean and dry. If at any point it gets wet or dirty, you definitely have to change it, because then you're opening up room for infection. And again, I reiterate, if you're diabetic, you want to see your doctor. And the reason that for diabetics is important also, if you have corns or hammer toes where it's starting to rub on the top of your toes and have wounds, you don't want to leave that, because there is not a lot of fat between your skin and your bone. And if the wound gets worse, we're looking at a bone infection, and that is just not what you want to deal with, because then there will be threatening amputating the toe or possibly the foot. All right. So important to note that all of these home remedies are just things that you can do. If it still persists after a while, you definitely want to see your doctor as soon as possible, because sometimes I've had patients that have come in and said, I sprained my ankle, but they broke their ankle, so they actually had to have surgery. Some patients will come, oh, I just have a corn or a callus or a thick skin, and they're diabetic, and I shave around and there is a whole wound with pus coming out of it. So if it's not getting better after a while, you definitely want to see a doctor. If you're diabetic or you have poor blood flow and you have a wound, do not soak your wound in warm water and soap. Just don't. Just clean it, apply antibiotic ointment on it, and then go see the doctor as soon as possible. Okay. So this of course, we talked about some of the things that we can do, but since we're talking about home remedies, I will stop this presentation here and then leave room to see if there are any questions.
Thank you so much. Was busy just taking notes. Okay. So do we have any questions? If we have any questions, please indicate by raising your hand or typing it in the chat. Do we have any questions?
There's a question in the chart. Hold on. I thought I saw something. Oh, thing is frozen. It's not working.
Okay.
Check it.
I'm checking. I can't see my side.
Okay, so it says, good evening. Thank you for, I recently sprained my ankle. Thank you. You're welcome. I recently sprained my ankle in the fall. I've been applying ice massage and lately hot water. The swelling and the pain has gone down, but I still feel pain coming up. Do I continue to exercise it on the staircase, or do I rest? Also, what more can I do? So with ankle sprains, there are 3 ligaments that most commonly get sprained. And a lot of the times, even after you've rested it, those are a little bit more intricate. I like patients to immobilize it with a boot, like a boot or a shoe or some sort of stiff device that will let that ligament heal. Because what happens in a sprain is you actually sometimes tear the ligament. And when you tear that ligament, you actually have to let it heal, just like you let your skin heal and things like that. And so when that's the case, I say immobilize, with a boot or any kind of stiff, even if it's just a bandage, immobilize it for at least 2 weeks and then slowly start to move with it. Sometimes physiotherapy is extremely important to kind of help your body get back to what's going on. And in some cases, I may have to give an injection to just kind of calm the inflammation down and let it get better. So in this situation, if you're still hurting, I can see you during the consultation and match, the physical findings of what you're telling me. And then sometimes after a while, I would recommend an injection in the area with a steroid, and that'll help with the pain and discomfort.
Okay. There's another chat. Can you see the question?
Yes. Can you talk about warm and hot feet in the night? I'm curious about why it happens and homemade remedies for that. All right. So that is actually an interest. Thanks for that question. We don't know why patients have hot or cold feet. Like I personally, my feet gets cold at night. There's some patients, they don't want anything on their feet. We don't know why that happens. The only exception is patients who have what we call restless leg syndrome, where their legs just move continuously. They can't, stay immobilized and things like that. Now, for both options, other than, of course, for cold feet, wear socks, and for hot feet, just apply air. I mean, there are medicines that you can use, but I don't advise to use them just because I feel like there are other things that can be done. Like, again, if you're warm, one of the things I'll tell my patients is to apply, again, like the Vicks Vapor Rub if you're cold, because that warmth will kind of help to, what that does is 2 things. It causes vasodilation, again, opens up the blood vessel. That'll bring warm blood to the area and it'll warm it up. And of course, the menthol and the Vicks Vapor Rub itself will cause it to be warm. And in in hot feet, that's a little harder because, you know, aside from just putting your feet by the fan, there's not a lot of home remedies for a warm foot, unfortunately, at this time. So I mean, you can wear, I do have like an ice pack that is in the shape of a sock that I give to my patients after I do surgery or something, you know, injection or things like that. So if someone who is chronically having hot feet and it's keeping them up at night, then I would say do that, because at least it'll cool you down enough where you can actually sleep. And I think most people, once they're asleep, they don't really, you know, think about it as much anymore.
Okay. Thank you.
Thank you for that question.
Okay, I don't see any other
Please,
questions.
what causes numbness in the feet in the morning? All right, so my question after this, I'll ask, does the numbness go away after the morning, or is the numbness just in the morning? Because there are several things that could be happening that causes numbness. So there's systemic issues like diabetes. If you're not having a lot of B vitamins in your diet, if you have some sort of anemia, pernicious anemia could cause, you know, which will then cause you to lack B vitamins and then numbness. If you have, we said diabetes, right? Back pain. So any kind of back problems, impingements, sciatica, meaning that impingement of the long nerve that goes, you know, the nerve from your back all the way to your foot. Sometimes that could cause numbness, or even just sleeping, you know, abnormally at night. So I think I need to find out, like, does this numbness go away after the morning, or is it constant throughout the day? And is it only in the morning? You know, so it's complex, and you know, I would have to like break it down. The most common one is diabetes, and if it's diabetes, then you have to manage the diabetes. Unfortunately, the worse the numbness is, the harder it is for us to bring it back. It's like, think of it like this: our nerves are the same thing. They're just in our fingers and our toes are the tiny versions of the brain stem, right? The brain has the spinal cord that goes all the way. Patients that have stroke, you know, you know, something's happened, you know, their nerves aren't working anymore. So if you can imagine how long it takes for us to rehab a patient who has stroke, imagine when the nerves are been damaged by excess blood sugar or whatever else that may have caused it, chemotherapy or stuff like that, you know. So we have to be patient in getting it back, but it's sometimes hard to get you 100% back, you know, once you have, you know, numbness, you know, caused by diabetes. But again, with that question, I think I need to evaluate more and ask more questions for me to answer appropriately. Will this recording be shared? I missed a good part of the presentation. I asked Dr. Okogu, Sister Lucia, to see if it will. Can diabetes alone cause swollen feet? No. There are other things there are lots of things that cause swollen feet. We have to check sometimes the veins. You know, if your feet if your swollen foot happens at the end of the day and not the beginning of the day, then, you know, we look at the veins. Sometimes we have to look at the kidneys. Is it both feet that are swollen? Patients that have congestive heart failure will have swollen feet and legs as well. We have to evaluate that. Sometimes if it's just one foot, then we have to then look at a musculoskeletal issue. Like, is there a sprain? Is there a fracture? Is there a break? Like, what causes it? So the short answer to that is no. There are lots of things that could cause swollen feet. Please, can we have the recording and slide? Okay. I walk for an hour every day as a routine exercise. That's good. What is the best way to reduce pressure off one's heel? Is there a better way to walk? Well, yes, there are ideal ways to walk, I should say. I wouldn't say better or worse. There are ideal ways to walk. And what that means is you're striking on your heel and you're going all the way. To reduce pressure off the heel, if you're having heel pain because you're walking, first thing I'll look at is the shoes. And second thing I'll look at is our stretching. I said stretching is one of, honestly, the single most important thing that you can do. So we need to see, how much are you stretching? Is the plantar fascia tight? Is the Achilles tendon tight? And one of the things I'll demonstrate, you know, if I get to see a heel patient, is actually how to do it. It's not just moving. There are certain things you should feel to know that you're actually performing this stretch adequately. Because if you're just moving and just stretching and you're not actually stretching the muscle, then we're not really doing a good job to get the result that we want. So I tend to show, if I see a patient that has heel pain, I'll show them how it's, you know, done. So getting good shoes, a shoe that has a nice cushion and nice support. Again, you want to make sure that if you're, I'll use this because I'm not gonna tell, but if I can squeeze your shoe like this, that you need to throw, you need to put that shoe somewhere and not walk with it. Maybe walk with it at home, but it's just not supportive enough for you to do an exercise. So if you're walking with sneakers or trainers, fold your trainers. The front part may be flexible, but the part that holds your midfoot and your heel should be pretty firm and not, just, super flexible. So that's a way to try to reduce it. Stretching, wearing good shoes, and of course, stretch beforehand. Wear good shoes, and then stretch afterwards, and of course, ice. What is the permanent cure treatment for plantar fasciitis apart from weight loss? Well, I mean, weight loss is not a cure, except it was a sudden weight loss. So if you gain like, and I'll use US metrics because that's what I'm used to, right? So if you gain like 20 or 30 pounds in a month, that is extreme amount of weight that was just put on your body, on your joints and your foot. So in that situation, weight loss is what you need because we need to take away that, that sudden increase in the weight. But a lot of the times, I mean, the treatment really, it's, again, we need to stretch. So there are two types of stretches I talk about, and I didn't talk about a stretch splint here because I didn't bring a stretch splint with me, but that stretch, after doing the stretches, and I'll print out sample stretches to kind of hand out if I have a patient that has heel pain, that those stretches that you have to do them constantly because those tendons have to relax and stop putting pressure on the heel. And the stretch splint, which is kind of like a boot while you're sitting watching TV in the evening after work, it's constantly, again, putting that stretch there. And then another treatment is an injection, honestly. An injection with a steroid in that area to reduce the inflammation. But on its own, it's not enough. We need to treat the biomechanics, which is with the stretching, and the inflammation, which is with the injection and medication. So the more permanent or long-lasting treatment for plantar fasciitis is stretching, icing, sometimes anti-inflammatories, either injection into the area or oral, good supportive shoes, weight loss in the case of a sudden increase in weight. So there are other things that can be done before we get to that part. So I hope I answered that, Dr. Elizabeth.
Okay.
Yes, thank you.
Okay. I have a question that was sent to me about the knee. So someone has said that they have knee pain, no trauma or anything, and it radiates to the ankle. The person is a teenager and was told that it's growth. It's because he's growing. So what do you say about that?
So sometimes there are, I mean, I don't treat knees, but yes, sometimes we do have the growth if there is a sudden increase again in height. So a similar thing happens in the heel for teenagers or growing kids. So in growing kids, we have open growth plates, right? And the open growth plates is where our bones are being built and all of that stuff. And what also happens in teenagers, kids get more active. They're running around, they're playing in sports, and they're just super active. And so there's increased pressure and increased trauma in this growth plate. And so that's usually what happens when they're like, and then of course, again, their muscle mass is also increasing and they're hitting various growth spurts where the muscle is increasing in a significantly faster period than their body can keep up with. So yes, sometimes it is growing pains, but even with that, so if I had patients that I would have, and I'll focus on the heel because again, that's what I see and treat with kids with open growth plate and heel pain. We rest it. We prevent them from doing any kind of high impact activity, jumping, running. If they're playing soccer or football or basketball or any, we hold them off from it till the inflammation kind of calms down. Because yes, the growth plate is going to expand, but now it's inflamed. So we just need things to kind of rest. So first things, I rest them. I take them off of every activity for at least 2 weeks. You can use anti-inflammatories as well to kind of help and manage it. As long as it's not an excruciating pain, there's not swelling, you just watch it for 2 weeks with a rest, strict rest for starters, and then kind of see how the patient does at that time. If the patient doesn't get better, that's when we start to do advanced imaging, like x-rays and MRIs and seeing if we're missing anything and stuff like that. But other than that, for an open growth plate individual with a unilateral, so one limb, and it's around the knee where we know there's a growing. First, inclination is, okay, let's rest this. And if it doesn't get better, advanced imaging to rule out other things that may be going on.
Okay, thank you so much.
Mhm.
I don't see any hands up.
How do you
Um,
manage arthritis of the knee? Pain comes from time to time, especially after exercise and strange activity. Actually, so I mean, again, I don't treat knees, but you know, a joint is a joint is a joint. They're just different types of joint. It's the same kind of cells and fluids. So arthritis essentially is loss of cartilage within the joint, right? So we have bone on bone. So I usually say it's painful reduction in motion or painful loss of motion. So essentially your bones are grinding. Um, there's not a treatment for arthritis because we cannot replace the cartilage except of course through surgery. But what I advise everyone who has arthritis of any kind or generalized inflammation, there are foods. I believe food is medicine, right? There are foods that I think that really not I think I know because there's studies on it that have powerful anti-inflammatory properties. They reduce inflammation. One of them is turmeric, right? You can get that in the market. You can get, you can get, sometimes if you're lucky, you can get turmeric pills. I personally take turmeric pills just because if I'm feeling like I'm burnt out a little bit or I'm just in an inflamed state. So turmeric pills or turmeric itself, if you cook it, it's really, really great. It helps tremendously with inflammation. Now, when you're cooking it, you want to make sure that there's pepper in it because that's what the pepper actually makes and helps it to be absorbed. All right. Another one is bromelain. Bromelain is a protein enzyme that is found in pineapples. All right. So it's found in the bark and the stem and the fruit and everything. So what I would do is I'll buy a pineapple, peel the bark of it, throw the crown away, peel the bark of it, but wash it and actually boil it and make a tea out of it. So if you boil the pineapple bark, garlic, ginger, you can skip the garlic. I'll put a little bit of the garlic, but ginger, pineapple bark, and I do green tea as well. These green tea, pineapple, both the fruit and the bark, and ginger, potent anti-inflammatory. So if you know that you're having arthritis and you're not ready to have surgery, you're not quite there if you make that tea and drink it every day, you can sweeten it a little bit with honey, put some turmeric in it if you want. Honestly, you would see after like 2 to 4 weeks, your generalized inflammation will start to reduce. So that is one thing that you can do at home to manage any kind of chronic pain where the answer is surgery, but you're not ready to have surgery, or you don't want to just keep taking medications. It is a slower process, but it is an effective process. Turmeric, bromelain, green tea, ginger, garlic as well. Those are really, really good ones that you can make a tea out of and just, drink it every night, and that'll help. And that is how you can manage the arthritis or the arthritis pain. Okay.
Thank you so much. I don't have any questions that were sent to me. Any that were sent to you? Okay. Do we have any other questions? Do we have any hands raised? I don't see any hands raised. Any comments? All right.
Awesome.
I have a comment just to say thank you, Dr. Shaw, for a brilliant presentation. We look forward to receiving you in the hospital.
For sure. Thank you. I look forward to seeing you. So bring your questions. I'll be at the hospital seeing patients. And like I said, if there are things that I see that I know, I have a solution for you, but I don't have it on hand, I can arrange for it to get, sent over so that we can, have it done, taken care of. But yeah, I look forward to seeing everyone, and they will share what day and time I'll be seeing patients.
Okay. I actually have someone who's asking about booking a remote consultation with a doctor to discuss knee calcification and back pain, and that it is causing feet pain. So we will get back to you. If you could please drop me your number, the person that sent me that message, and we will get back to you to discuss that. Okay?
Yes.
Go ahead.
No, I was going to say, yes, that's actually a good idea. So of course the goal is that, hopefully every 3 to 4 months I come back and see patients. So the best thing to do is if you miss this chance to get to see, get a consultation is, we can do a virtual beforehand, and that also helps me prepare if I need to bring something with me that I think. But let's say I have a patient that has warts now. You know, if I do a virtual beforehand and I know that okay, this is likely what it is, then I can bring the medication that you can then take home, and you know, the hospital can will work with you and how to get all of that to you. So if you don't have to wait to see me now, I mean, it's good to see. But if something comes up later, of course, talk to the hospital and they'll set up some sort of virtual consultation.
Okay, thank you. And to that person, I have received the email, so we will be getting in touch with you. Those who asked for the recording, if you did register, you would actually automatically get a link of the recording. And if you don't do that, please kindly reach out to us in the hospital. We will definitely send that to you. I don't see any other questions. Okay.
All right.
So thank you again, Dr. Shobowale.
Thank
It's
you.
been fun. Thank you so much.
No
I know
problem. Of course, I appreciate it.
this
Thank you.
that fungus is among us is now stuck in my head.
Fungus is among us. Yes.
So thank you
All
very
right.
much. Thank you for everyone who joined. For those who joined on time, thank you again for your patience. We will be continuing our health education series, so watch this space. We have so much more coming up. Thank you, Dr. Shobowale. Thank you, Dr. Anya. All right. So everybody have a good day.
Have a good evening. Thanks. Bye.